The chief surgeon threw me out of the operating room. 3 hours later, the patient I warned him about was dead. This is how I ended his career. My name is Emily Carter. I'm 31 years old, and I'm a surgical resident at one of the biggest hospitals in the state. When I say I'm a resident, most people think that sounds impressive, like I'm almost a real doctor. They're wrong. Being a resident means you're at the bottom of the food chain. You're everyone's assistant, everyone's errand girl. I work 80-hour weeks, sometimes more. There are weeks where I don't see sunlight, where I forget what day it is. I've slept in supply closets. I've eaten dinner standing up in a hallway at 3 in the morning. I live on vending machine coffee, and the hope that one day this will all be worth it. One day, I'll be an attending. I'll have my own patients, my own OR time, my own respect. But first, I had to survive, and surviving meant keeping my head down, not making waves, not questioning the attendings. That was the plan anyway, until I met Dr. Harrison Blake. Let me explain how a hospital works, because most people don't understand the hierarchy. At the top, you have the attendings, the real doctors. They make the decisions. They run the show. Then you have the fellows, doctors who've finished residency and are specializing even more. And senior residents, 4th and 5th year, they're almost done, almost free. And then people like me, 3rd-year residents. We do the grunt work, the paperwork, the overnight shifts nobody else wants. We're there to learn, but mostly we're there to obey. Don't question the attending. Don't argue with their decisions. Don't make waves, because if you do, you get a reputation. And a bad reputation in a hospital, that can end your career before it even starts. The power dynamic is real. An attending can write one bad evaluation and suddenly you're not getting a fellowship. You're not getting good recommendations. You might not even finish your residency. So you learn to stay quiet. You learn to nod. You learn to say yes, doctor, no, doctor, whatever you say, doctor. Even when you know they're wrong. Dr. Harrison Blake, chief of surgery, 62 years old, been operating for 25 years. In the hospital, he's a legend. People talk about him like he's some kind of god. Dr. Blake did this. Dr. Blake saved that patient. He's won awards. He's been published in major medical journals. He teaches at the university. He's also a complete nightmare to work with. Dr. Blake doesn't just have confidence. He has arrogance. The kind of arrogance that comes from 25 years of people telling you you're brilliant. He doesn't listen. Not to nurses, not to residents, not to anyone. I've seen him snap at nurses for handing him the wrong instrument. I've seen him humiliate residents in front of entire surgical teams. One time, I watched him dress down a 2nd-year resident in the middle of rounds. The guy had suggested a different approach to a patient's care, just a suggestion. Dr. Blake stopped mid-sentence, turned to him, and said, "When you've been practicing medicine for more than 5 minutes, then you can tell me how to treat my patients." The resident went red. Everyone else just looked at the floor. Nobody said anything, because that's what you do. You stay quiet. For 2.5 years, I avoided Dr. Blake. I kept my head down. I didn't want to be on his radar. But in my 3rd year, I got assigned to his service for a month. I had no choice. I had to work directly under him, assist in his surgeries, round with him, shadow him. It was supposed to be the longest month of my life. It ended up being the month that changed everything. The first week was tense, but manageable. I showed up early. I stayed late. I triple-checked every patient chart. I made sure I knew every detail before rounds. Dr. Blake barely noticed me, which was exactly what I wanted. I assisted in 4 surgeries that week. I handed him instruments. I stayed quiet. I didn't ask questions unless absolutely necessary. I was invisible. Perfect. Then came the 2nd week. We had a post-op patient. Gallbladder removal from 3 days earlier. She was complaining of pain. Sharp pain in her upper right abdomen. I examined her, checked her vitals, looked at her incision site. Something felt off. Her pain was worse than it should be, and she had a low-grade fever. Not high, but there. I thought maybe there was an infection, or maybe a small bile leak from the surgery. During rounds, I mentioned it to Dr. Blake. I said, "Doctor, Mrs. Patterson is reporting increased pain. She also has a temperature of 99.2. Should we maybe order an ultrasound, just to be safe?" He looked at her chart for maybe 5 seconds. Then he said, "It's normal post-op pain. Give her more pain meds. She'll be fine." I pushed back, just a little. I said, "I understand, But the fever, he cut me off. Mitchell, do you know how many gallbladder surgeries I've done? I didn't answer. Over 3,000. I think I know what normal post-op pain looks like. Give her the meds. Move on. So I gave her the meds, and we moved on. The next day, she was worse. Her fever was up to 100.4. Her pain was so bad she couldn't stand up straight. I ordered the ultrasound myself, without asking. It showed a small bile leak, exactly what I'd suspected. She needed a follow-up procedure. Dr. Blake did it that afternoon, fixed the leak. She recovered fine. He never thanked me, never acknowledged I was right, but from that day on, I could tell he didn't like me. I'd embarrassed him. Even if no one else knew it, he knew, and that was enough. Then came Margaret Chen. She was admitted on a Tuesday, 62 years old, retired teacher. Came in with right upper quadrant pain, nausea, classic gallbladder symptoms. Imaging confirmed it, gallstones. She needed surgery. Dr. Blake was assigned. It was supposed to be routine. Laparoscopic cholecystectomy, outpatient procedure. She'd go home the same day. I was assigned to assist. The surgery was scheduled for Thursday, 2 days away. On Wednesday night, I was doing my usual prep. I review every patient's chart the night before surgery, every lab result, every medication, everything. I always do this. It's a habit I learned from one of my favorite attendings in my first year. He told me, "The OR is not the place to learn something new about your patient. Know everything before you scrub in." So I reviewed Margaret Chen's chart. Medical history, type 2 diabetes, well controlled. Hypertension, also well controlled. No major surgeries, no known allergies. Medications, metformin, lisinopril, nothing unusual. Then I saw her pre-op blood work. Most of it looked fine. Glucose a little high, but expected for a diabetic. Kidney function normal. Liver enzymes normal. But her platelet count, 95,000. Normal range is 150,000 to 400,000. 95,000 is low, not critically low, not cancel the surgery immediately low, but low enough to make me pause. See, platelets are what help your blood clot. When you bleed, platelets rush to the site and plug the hole. If you don't have enough platelets, your blood doesn't clot properly. And surgery, even routine surgery, involves cutting, and cutting means bleeding. I went back through her chart, looking for an explanation. Had she always had low platelets? Was this normal for her? I found her labs from 6 months ago. A routine physical. Platelet count, 180,000. Normal. So something had changed. In the last 6 months, her platelet count had dropped. Maybe it was nothing. Maybe it was a lab error. Maybe it was a temporary thing. Or maybe it wasn't. Maybe she had an underlying clotting disorder. Maybe she was on a medication that was affecting her platelets. Maybe something else was going on. I made a note in my resident log, flagged it, wrote down that I wanted to discuss it with Dr. Blake in the morning. Then I went home, got maybe 4 hours of sleep. The next morning, I got to the hospital at 6 a.m. Surgery was scheduled for 2 p.m. I wanted to catch Dr. Blake before rounds, talk to him privately, ask him if we should delay the surgery and run more tests. I found him in the surgeon's lounge. He was reading a journal, drinking coffee. I knocked on the door frame. He looked up. "Dr. Blake, do you have a minute?" He didn't say yes. He just looked at me, waiting. I explained. I told him I'd reviewed Margaret Chen's chart. I showed him the platelet count. I showed him her old labs. I said, "Her platelets have dropped significantly. I'm wondering if we should delay the surgery and run a coagulation panel, just to make sure her clotting function is okay." He looked at me for a long moment. Then he said, 95,000 is fine. I said, "I know it's not critical, but it's below normal. And with surgery..." He cut me off. "Did I ask for your opinion, Mitchell?" His voice was calm, but there was an edge to it. I said, "No, sir. I just thought... You thought wrong." He stood up, closed his journal. "I've done over 3,000 gallbladder surgeries. I've operated on patients with platelet counts in the 70s, 60s. This patient is fine." "But how many of these have you done, Mitchell?" I hesitated. "Maybe 30? 30. I've done 3,000. Don't tell me how to do my job." I tried one more time. I know I shouldn't have, but I couldn't let it go. I said, "I understand, doctor. I just think for patient safety, it might be worth delaying." He pointed at the door. You're off this case. I stared at him. What? You heard me. You're off. I'll get another resident to assist. You can go check on post-ops. I stood there, not believing what I was hearing. Dr. Blake, I'm not trying to undermine you. You're just wasting my time. Get out. I left. I walked out of that lounge, my hands shaking, my face burning. I'd been kicked off a case for trying to protect a patient. I wanted to fight back. I wanted to go to the chief medical officer, to the residency director, to someone. I wanted to say, this isn't right. I was doing my job. I was advocating for patient safety, but I didn't. You want to know why? Because I was scared. Scared of getting a bad evaluation? Scared of getting blacklisted? Scared of Dr. Blake making one phone call and ending my career before it started? That's the reality of being a resident. You have no power. You have no protection. If an attending wants you gone, you're gone. So, I stayed quiet. I went to the post-op floor. I checked on patients. I pretended everything was fine. But inside, I was furious and terrified because I knew I was right. I knew that platelet count was a red flag. I knew Margaret Chen was at risk. And I knew that if something went wrong, it would be my fault for not fighting harder. But what could I do? I was just a resident. Surgery was scheduled for 2 p.m. I spent the morning trying to distract myself, checking labs, writing notes, anything to keep my mind off it. But I kept checking the OR board. 1 p.m., pre-op complete, patient in holding. 1:30 p.m., patient moved to OR 4. 1:45 p.m., anesthesia started. 2 p.m., surgery began. I tried to go about my day, but I couldn't focus. I kept thinking, maybe I was wrong. Maybe Dr. Blake is right. Maybe I'm just being paranoid. 2:30 p.m., I checked the board again. Surgery still in progress. Expected completion, 3:15 p.m. 3 p.m., still going. Gallbladder removals usually take 60 to 90 minutes. We were already past 90. I told myself it was fine. Sometimes surgeries run long. Maybe there were adhesions. Maybe it was just taking longer than expected. 3:15 p.m., I was in the resident lounge, writing a note on a patient. And then the overhead speaker crackled. Code blue. Operating room 4. Code blue. Operating room 4. My heart stopped. OR 4. That was Margaret Chen's room. I ran. I know I wasn't supposed to. I wasn't on the case. I'd been kicked off, but I ran anyway. When I got to the OR floor, it was chaos. Nurses running, the code team rushing in with the crash cart, anesthesiologists shouting. I couldn't get into the OR, but I could see through the window. There was blood everywhere. On the drapes, on the floor, on Dr. Blake's gown. Too much blood. I knew what had happened. She was bleeding, and her blood wasn't clotting. Exactly what I'd warned him about. Through the window, I could see them trying everything. Transfusions, clotting factors, pressure, suction. Dr. Blake was moving fast, yelling orders, but I could see it in his face. He was losing her. I stood there, outside that OR watching, feeling completely helpless. 15 minutes went by, then 20, then 30. The code team kept working. Compressions, medications, more blood. But it wasn't enough. At 4:47 p.m., they called it. Time of death, 4:47 p.m. Margaret Chen was dead. I stood there in that hallway, numb, watching as they cleaned up, watching as Dr. Blake pulled off his gloves, watching as they wheeled her body out. Dr. Blake walked right past me, didn't even look at me. His face was blank, like nothing had happened. I wanted to scream at him. I told you, I warned you. This didn't have to happen. But I didn't say anything. I just watched him walk away. That night, I couldn't go home. I sat in the resident lounge, alone, staring at the wall. I kept seeing her chart, her platelet count, the flag I'd put in my notes. I kept hearing Dr. Blake's voice. Don't tell me how to do my job. She didn't have to die. If he just listened. If he just ordered one more test. Delayed the surgery by 1 day. She'd still be alive. And I knew nobody would do anything about it, because that's how it works. Surgeons have complications. Patients die. It's part of the job. Nobody questions the chief of surgery. Except me. I went back to my locker, pulled out my laptop, logged into the hospital system. I pulled everything. Margaret Chen's chart, her pre-op labs, my flagged notes from the night before, the OR timeline, the transfusion records, the code blue report. I made copies of everything, saved them to a flash drive. Then I found the hospital's Quality Assurance Committee website. They have an anonymous reporting form for staff to report safety concerns without fear of retaliation. I'd never used it before, never thought I'd need to. I filled it out. Patient name, date of surgery, details of the concern. I attached all the files, the labs, the notes, everything. I hesitated for a long time, my finger hovering over the submit button, because I knew what this meant. I was going to war with the chief of surgery. But then I thought of her. Margaret Chen, 62 years old. Retired teacher, a woman who came in for a routine surgery and never went home. I clicked submit. And just like that, it was done. I closed my laptop, went home, and waited.